The Women's Health and Mammography Institute offers a multidisciplinary and holistic approach to women's health and breast care, headed up by Dr. Nadia Jajbai.
Women need to start reprioritizing their health. We are the gatekeepers to our family's health, and we tend to put ourselves last. Daily in my practice, I see women not prioritizing their own health. They tend to delay their medical examinations, don't feel it is that important to go for a general medical checkup, especially if they're doing well. Screening examinations are also a worry for women because they tend to be fearful to be diagnosed with a cancer. Our lifestyle choices and perhaps a genetic history in our family and even environmental factors affect our health, and we should be going for screening examinations to make sure that we are in the best of health and we have the best to give others.
Part of ensuring women's health is understanding the importance of regular checkups and screenings, which can help in making critical and life-saving health choices.
Screening tests have become very readily accessible, from simple tests like during your general medical checkup to have your blood pressure tested, blood tests including your cholesterol level, your fasting glucose or sugar level, as well as screening examinations for cancer like yearly mammograms, as well as the simple pap smear to screen for cervical cancer.
Thandi Mudise's life was changed forever after a regular checkup with her doctor. She was diagnosed with breast cancer, which was fortunately caught in the early stages.
And then I found out that I had cancer, breast cancer. First of all, she discovered dots. So I had no symptoms whatsoever. I had no lump, no discoloration, nothing. Now the mammogram is more thorough than just using the hand. That's why I totally encourage girls to go for mammograms, because you can always miss it with your hand, and also the doctor knows what to look for. And a week later I got the results from the biopsy. Biopsy was positive, and when I found out I just broke down because I thought it was just a death sentence. I cried in her room, and she told me, look, you know what, you're gonna be fine. All you have to do is take 1, 2, 3 steps and you'll be fine. One of them is a mastectomy, 2 is chemotherapy. You are lucky, you are very, very lucky. You're not gonna die. You see, I also come from a family where I have lost all my siblings and I'm the last child. So now I was like, oh no, now it's my turn, you know? So the first thing I did was go and tell my parents, and drove to Pretoria crying my eyes out. And I bought a bottle of champagne and I kept talking to my parents' house, and then my parents were like, oh, are we celebrating something? I was like, oh, yes, no, kind of, really, I'm not sure, but listen, Pop, I have breast cancer, but the good thing is that it's still at the early stage, so we can remove it.
Raising awareness about breast cancer and other female-specific conditions can help change perceptions which keep women from enjoying the best health possible.
People used to think it was a white woman's disease, and the way I found out was it was just by coincidence. I'd gone for an annual checkup, and my gynecologist said, look, cancer seems to be occurring at a younger age and amongst black girls. Go and get yourself checked. And I was not 40 yet either. Get yourself checked, because early detection is a cure for breast cancer. Once you reach stage 2 to 3, it gets more difficult to try and cure a person who has breast cancer, and also the likelihood that it has spread to the rest of your organs and the rest of your body is greater. Oh, you know, you have to be strong.
You don't need a reason or a special occasion to take charge of your health. Make the change, get screened, and take the first step to a better life.
Ladies,